It's not exactly a secret that the United States government isn't operating like a well-oiled machine at the moment. Our nation's systems of checks and balances are completely out of whack. The independence of almost all our federal institutions is being eroded, and the processes necessary for a functioning government have been hijacked by one of the two major political parties, unilaterally escalating the elimination of established norms and unwritten rules that are essential for the maintenance of regular order. Even if you're not someone with their ear to the ground to the daily goings-on in Washington, D.C., it's probably become pretty clear to you that a lot of the basic functions that are supposed to be carried out by the U.S. government are not happening in the ways that they're supposed to. Whether or not you think this dysfunction is a good or a bad thing is likely dependent on where you fall on the political spectrum, but regardless of your personal value judgment, it is indisputable that the traditional mechanisms of governance are breaking, if not already broken. At the time I'm recording this, the U.S. government is in a shutdown. On its own, a government shutdown is not necessarily an indicator that the government is on the verge of a collapse. Since 1980, the federal government has partially or fully shut down 11 times when Congressional Democrats and Republicans have been unable to come to an agreement on federal funding. But while many of those previous shutdowns had severe consequences for our economy and for our federal workers and contractors, none of them were as indicative of large-scale government dysfunction as this current shutdown. Given all of that, I thought that it might be worthwhile to run through the reasons for the current government shutdown, the underlying forces that caused it, what it means for America, and what you can do about it. The timeline for this current shutdown begins this past March, when Congress was trying to come to an agreement on a funding package for fiscal year 2025. Now, the federal government runs on an October to September fiscal year, so by this point we were already 6 months into the current fiscal year that should have been dealt with all the way back in October. But this is not exactly a shocking development. The last time the U.S. government funded the government completely on time, the number one song on the top 100 Billboard charts was the Macarena. They're not exactly a punctual bunch. Now, in between the October 1 start date of fiscal year 2025 and March of this year, the entire political balance in Washington, D.C. and the nation had shifted. Donald Trump won a second term in the White House, while Republicans gained control of the Senate and retained control of the House of Representatives, giving the GOP control of the three biggest levers of electoral power in Washington. They were in the driver's seat, whereas Democrats had been in control of both the White House and the Senate back in October. Republicans gambled that they would be in a better negotiating position for funding talks after the 2024 elections, and they won. But there are a number of mechanisms that are baked into the rules that guide Congress that are meant to protect against single-party legislating that ignores the demands of the minority party, particularly when the majority only has a small electoral advantage. In the Senate, any regular funding bills, also known as appropriations bills, need to have 60 votes to secure passage, whereas in the House, it only requires a simple majority. So, absent an electoral landslide that results in one party controlling at least 60% of the Senate, a certain amount of bipartisan cooperation is required to pass annual funding bills. Over the last several decades, the usual pattern has been for Republicans to push for cuts to safety net programs and to social services that need to be funded on a yearly basis whenever they are in control of Congress, and for Democrats to propose spending bills that increase spending for those same safety net programs and social services when they are in power. But things were different in 2025. Instead of advocating for a new set of spending bills that would slash funding for public health programs and for food and housing assistance, Republicans in Congress were pushing for a continuing resolution. With a continuing resolution, Congress just uses the funding numbers from the previous fiscal year and applies them to the current fiscal year, usually with some exceptions thrown in with the final bill as well. But this continuing resolution was worded in such a way as to provide the maximum possible discretion to the Trump administration to use the funding in ways that they saw fit, rather than what was originally intended. So in writing this continuing resolution and removing a lot of the congressional instructions from the previous fiscal year, Congressional Republicans were shifting control for enacting spending cuts and reallocating funding to programs they like from Congress to the White House. It was level funding in name, but not in practice. Democrats understood what their Republican colleagues were attempting to do with this continuing resolution, but they didn't have the unity within the party to prevent it from passing. While almost all House Democrats voted against the continuing resolution, 9 moderate Democrats in the Senate, including the top Senate Democrat, Minority Leader Chuck Schumer, ended up voting to allow the bill to pass a procedural hurdle that ultimately resulted in its passage. Why would some Senate Democrats vote for a bill they knew would provide the Trump administration with additional power to slash programs that benefited tens of millions of Americans. Well, the reasoning was that voting for the continuing resolution was actually the lesser of two evils, and that voting against the continuing resolution, and by extension, forcing a government shutdown, would actually provide the Trump administration and Elon Musk's Department of Government Efficiency with even greater opportunity to slash federal workers and programs due to the increased powers allotted to the White House during a shutdown. Did the strategy of the non-moderate Democrats work? No, it did not work. Keeping the government up and running did very little to curb the Trump administration's often unlawful efforts to shrink the size of the federal government and unilaterally cut spending from programs and departments that they just didn't like. And while we'll never know if forcing a March shutdown would have been a better strategic move for the Democrats to make in the long run, we know pretty conclusively that the strategy they did employ, namely to not stand united in opposition to the Congressional GOP's willful abdication to the Trump administration of their constitutionally guaranteed power to control spending decisions, was not a successful one. Then, to make matters worse, congressional Republicans spent the rest of that spring and much of the summer working to pass a bill through the reconciliation process that would extend and increase the 2017 Trump tax cuts for the wealthiest Americans at the expense of support for social services and health care for the poor and the working class. Reconciliation is a tool that parties who control both chambers of Congress often use to pass legislation related to federal spending without needing to garner a 60-vote majority in the Senate, instead only requiring a simple majority. The reconciliation process was what Republicans used in Trump's first term to pass their massive tax cut package for the rich, and what they tried and failed to use to repeal the Affordable Care Act. It was also what Democrats used during President Biden's time in office to pass the Inflation Reduction Act, which provided significant investments for increasing healthcare access, supporting green energy initiatives, and a bunch of other things. The reconciliation bill that congressional Republicans ended up passing over the summer was an absolute nightmare. The bill was the most naked attack on health care for the working class and middle class in U.S. history. It authorized more than $1 trillion in cuts to the Medicaid program, the largest cut to Medicaid ever, and imposed harmful and ineffective mandatory work reporting requirements on Medicaid recipients. These mandatory work reporting requirements were not designed to get people on Medicaid back to work, because more than 6 in 10 Medicaid recipients are already working, and another 3 in 10 are either full-time students, caregivers, or unable to work because of a disability. Instead, it was designed to drown Medicaid recipients in so much bureaucratic red tape and paperwork that they would be kicked off Medicaid, even though they met all the criteria to be a part of the program. And as if that wasn't bad enough, the GOP also included new cost-sharing requirements for those who have gotten coverage through the Medicaid expansion process, forcing poor and working-class people to pay for their health care with money they simply do not have. But part of what made the Republican reconciliation bill so awful was something that they didn't put in, and that was the Enhanced Premium Affordable Care Act tax credits. Now, I can feel a lot of you already starting to tap out because the words Enhanced Premium Affordable Care Act tax credits is basically NyQuil with an Ativan chaser. But just stick with me for a minute. These Enhanced Affordable Care Act tax credits are just a fancy way of saying money that the federal government gives working class and middle class Americans so they can afford health care. That's it. The way the Affordable Care Act was set up provided premium tax credits to individuals and families with incomes between 100% and 400% of the federal poverty level. In 2025, that is between roughly $15,000 and $63,000 for an individual, and between $32,000 and $129,000 for a family of 4. What these enhanced premium tax credits do is help lower insurance premiums for more than 20 million people who don't have access to affordable health insurance through their employer, helping more Americans get health coverage than ever before. If these enhanced premium tax credits are allowed to lapse at the end of this year, it is estimated that more than 5 million Americans will lose their access to health care and that premiums will go up by an average of 93%. So, as an example, a single person working full-time and getting paid $11 an hour would see their insurance premiums go from $0 a year with the enhanced premium tax credits to $794 a year without them. If you work full-time and make $13.50 an hour, you're going to pay over $1,200 more without the tax credits. And it's just as bad for families. A family of 4 with a household income of just $45,000 goes from paying nothing for an Affordable Care Act health plan to paying more than $1,600 a year on healthcare premiums. These kinds of massive price hikes are simply not feasible for any individual or family living anywhere near the poverty line. If the Enhanced Premium Affordable Care Act's tax credits go away, healthcare will simply become unaffordable to millions of people and will drain the finances of tens of millions more. And this is why these Enhanced Premium Affordable Care Act tax credits are at the heart of the current government shutdown. When congressional Republicans tried again last month to do what they did in March and push through a quote-unquote clean continuing resolution to fund the federal government through Thanksgiving and continue to give the Trump administration increased freedom to slash spending for another couple of months, congressional Democrats weren't having it. To quote that old wordsmith George W. Bush, "Fool me once, shame on you. Fool me ain't gonna fool me again." Congressional Democrats essentially said, if you want us to sign off on a bill that continues to enable the Trump administration to take a pickaxe to congressionally funded programs that benefit tens of millions of Americans, we're going to need something in return. And so Senate Democrats put out their own continuing resolution that included a laundry list of things they needed to be addressed before they agreed to continue funding the government. This list included the restoration of more than $1 trillion in cuts to Medicaid that were included in the Republican reconciliation bill, as well as adding language to funding bills that would mandate that the Trump administration spend money as Congress intended it to be spent. And it also included extending the Enhanced Premium Affordable Care Act tax credits. How long will this government shutdown last? I don't know. But what's possibly more important than how long it lasts are the circumstances under which it came to pass. Generally speaking, Democrats are much more reluctant than their Republican counterparts to support any strategy that involves a government shutdown because Democrats like government programs and don't want to inflict pain on federal workers. But in the current political environment, they were really left with no other choice. Congressional Republicans had already shown that they were willing to hand over massive amounts of power to the Trump administration and to almost solely focus on a legislative strategy that didn't require Democratic votes or voices. This continuing resolution vote and all of the funding votes that will come after it are the primary leverage point that Democrats have during the current Congress, and they used it, even if it was paired with the possibility of significant economic harm being done to federal workers and contractors. After 9 months of the second Trump administration, even the most centrist of Democrats looked around and realized that the Trump administration was going to do everything they could to destabilize and destroy our public health infrastructure and our social safety net, regardless of what they did, so they might as well fight back while they're at it. Now is the time for us to join the fight as well. There are many ways we're going to be active collectively in the coming months and years to push back on the authoritarianism that's already here and to protect what is left of the current social safety net and provide us with the opportunity to mobilize and organize to create a better future for everyone. Outside organizing is amazing. Protests and demonstrations and boycotts are incredible. Voting is essential. But we also need to demand access to affordable and life-saving healthcare from elected officials in Washington, D.C. while they're in office. I'm going to provide a link to an action alert from AIDS United both on the screen here and in the comments below, urging Congress to extend the Enhanced Premium Affordable Care Act's tax credits and ensure that 5 million people do not lose their health insurance. It may seem like a small thing at a time when so much is being unraveled and destabilized across this country, but I promise you it will make an immense difference to the more than 5 million people who rely on these tax credits for access to health care. It will save lives. And it will have the added practical benefit of reinforcing for Democratic members of Congress that there is real practical value in standing up for your principles and fighting for services your constituents rely on.